Hello, I'm Dr. Rhonda Johnson. Today is January 30th. It's Thursday, 2025, and I'm talking about tuberculosis. But first, my heartfelt condolences to all the victims and their families of that midair crash of the American Airlines plane and the Army helicopter over the Potomac River yesterday. This is just such an unthinkable tragedy. But back to TB. It is a serious infection that is caused by Mycobacterium tuberculosis. That's a bacteria. It primarily affects the lungs, but it can also impact other parts of the body. Now, TB spreads through the air in droplets when an infected person coughs, sneezes, talks, or even sings. Symptoms of TB are a chronic cough. Sometimes the cough is associated with the production or coughing up of blood-tinged mucus or phlegm. Other symptoms include, with the cough, chills, fever, loss of appetite, weight loss, wasting, and night sweats. Now, there are risk factors for TB progression or contracting TB. One is if you have a weakened immune system. Conditions like HIV, AIDS, diabetes, or certain cancers can compromise your immunity. Also, close contact. If you live or work in close quarters with someone who has active TB, such as in your household or your healthcare setting or correctional facilities, that can increase your risk. And then there's substance abuse. Chronic smokers, people who drink excessive alcohol consumption and illicit drug use can elevate their risk. And of course, malnutrition and living in poor conditions, for example, overcrowded, poorly ventilated environments, facilitate TB transmission. Now, globally, there are hotspots. TB remains a significant public health concern worldwide. Regions with higher prevalence are Southeast Asia, Africa, and the Western Pacific. So what about the United States, you may ask? Well, it's been relatively low here compared to other parts of the world. However, certain people are at increased risk here in the United States, including individuals who were born in or who frequently travel to countries where TB is endemic. People with HIV, AIDS, and weakened immune systems have a higher risk in the United States also. Now, if you have been listening to the news or listening on social media, you may have heard about an outbreak in Kansas City. So as of January 24th of this year, there are two counties, primarily in Wyandotte and Johnson counties. There are 67 active TB cases and 79 dormant or latent TB infections reported. The outbreak began last year in January, and 2 people have died. And public health officials are doing contact tracing, testing, and community education to contain the spread of TB. Now, we don't have information on the index case or the 2 fatalities, so we don't know how it got started. Now, what I want you to know is TB is curable. Treatment involves a prolonged course of antibiotics, sometimes multiple antibiotics. That can go at least 6 months or more. And you have to adhere to the full treatment regimen to prevent the development of drug-resistant TB strains. So that's my message today. I know it's a little long, but I want you to understand TB. Take care. Be well.